So what is happening within a heart attack? We have our heart here. That is our left side of the heart, and here we have the right side of the heart. We're not looking at the wrong way around. We always talk about left and right on opposing sides as we look directly at them. So here we have, down in this bottom corner here, the left ventricle. Now this left ventricle pumps out huge amounts of blood, and this goes off around to the systemic system. So this is down to the legs, around the body, so the vital organs in the abdomen, the chest, and also up to the head and to the brain. Now, with a heart attack, the left ventricle will typically pump out blood out of the aortic arch. That goes over the top. There's a huge artery exiting the heart through the aortic valve, which sits, let's go to a black aortic valve, which sits just at the top or below the aortic arch. Now, within a heart attack, the blood will be pumped out of the left ventricle here, and it will be ejected up through the aorta and over the top of the aortic arch. Now, when the heart goes into diastole, which means the relaxing phase, some of this blood up here does not quite make it over the arch, and it falls back and lands here on the top of this valve, the aortic valve. And what will happen here in diastole, where we're relaxing, is this blood will drain off, and it will drain into the heart, and it will then be used as oxygenated blood around the heart itself. The heart is obviously a vital organ, and it requires its own blood supplies to function. So blood here will travel down these vessels. These are known as the coronary vessels, and there's 3 main coronary vessels, and these will supply the heart. And we've seen many pictures and diagrams of the heart with these kind of veins, what they look like veins around the heart, but these are actually little coronary arteries that supply the muscle of the heart to function correctly. Now, within a heart attack, what can happen is we can have a clot. So let's pop our clot in, and our clot can come through the heart, and it can sit in here, drop down, work its way into these coronary vessels, and as these coronary vessels spread themselves out, they get narrower and narrower, and depending on the size of the clot and the route it travels depends on the size of the patient's heart attack. Now, a very small clot may end up right down at the very distal end of a coronary artery, thus causing very little signs and symptoms of a heart attack, and it may even pass without a patient really recognizing it. It's sometimes not identified till later on other observations or tests in hospital that they identify that maybe this patient has had a heart attack in the past. However, bigger clots can block up the coronary arteries, and what will happen here is they will occlude blood flow anywhere beyond that blockage. So depending on which of the 3 coronary blood vessels take the clot down, it can be here at the what we call the widow's notch, where all 3 branch off, and this will lead to a massive heart attack and most likely into a cardiac arrest. But if it does travel down one of the coronary arteries, depending on how far it gets down, depends on the patient's size of their heart attack, and obviously the result, or the quality of life as well afterwards. So this patient here has this clot here, and this part of the heart now is not receiving adequate amounts of blood flow. So this heart is going to become what we call ischemic, which is lacking in oxygen and blood flow. And this will be where our patients classically get what we call the chest pain. A lot of patients that I visited or had in front of me having heart attacks don't really describe it so much as a pain, more as a discomfort and heaviness of the chest. And they also feel awful with this pain as well. They feel very lethargic, tired, fed up, can't be bothered is really the best way to describe it. So this is what's going on with your heart attack.